I'm David Schkade. I'm the Jerome Katzin Professor at the Rady School of Management at the University of California, San Diego. My primary focus of my research is the psychology of decision making, which examines the processes by which people use information to make decisions. This field exists at the confluence of several other fields, particularly psychology, economics, statistics, and sociology. And so all of these factors have an influence on how people make decisions, and we use those resources, intellectual resources, to help us in deciding what to study and how to study it. First, I'm a member of the Scientific Council, which helps to oversee parts of the work. And in the report itself, I'm a co-lead author of Chapter 8, which is a recapitulation and summary chapter with recommendations for the future of the first section of the book, which is primarily about economic issues. And so the title is New Perspectives on Social Justice and Well-Being. So that's my specific role. I think IPSP is an attempt, and I think a noble attempt, to introduce different criteria for success of societies into the discussion around the world about how well a society is doing. At this point in time, economic activity is the dominant metric that's used to decide how well economies are doing. Or countries are doing in developing and so forth. And so I think there's a lot to life besides money, and those things aren't measured. And as the old saying goes, if you don't measure it, it doesn't get considered. And so I think this is a possible outcome of the IPSP, is to enrich and expand the set of criteria that societies will be striving towards as they develop. The work that I've done that's most relevant to the IPSP objective mission has been our work on well-being. And there are really three aspects of that work that are particularly relevant. The first one has to do with how people decide how well they're doing. One of the most asked questions in the history of survey research is a question about life satisfaction that goes about like this. Taking everything into consideration, how satisfied are you with your life these days? And that question has been asked literally tens of millions of times to people all over the world. And that is an attempt to capture some sense of the subjective well-being from the person's point of view that they are experiencing at this moment in time. Well, that question is what we call a global retrospective question. And what that means is that you ask someone the question, they, by some process unknown to us, and unknown to the person often, interrogate their memory, make some judgments, and then they come up with an evaluation. Well, these types of questions have been shown under many circumstances to be highly context sensitive, and how they get answered depends on how they are asked, and so forth. In fact, my colleague Norbert Schwartz has this beautiful study where you ask college students how well they're doing. And if you ask them the well-being question, this life satisfaction question first, and then ask them how many dates they had in the last month, there's no correlation between the two. But if you ask them how many dates they had in the last month, and then ask them about well-being, all of a sudden there's a high correlation between the two. So this is an example of the context sensitivity of well-being judgments. So one of the things we were interested in was which information people choose to emphasize when they're making this judgment, because when they're interrogating their memory, there's some pattern to this, and it's not just completely random. And so there's a long-standing debate between my colleague Danny Kahneman and his wife Ann Treisman, both of whom are very distinguished psychologists, about whether living in California made people happy. And so in part motivated by that, and in part motivated by some other interests, used the idea of climate as an independent variable that might affect well-being. And so we compared people in the upper Midwest, in Michigan and Ohio, to people in Southern California on well-being. And we asked half of the people in Southern California, we asked about themselves or somebody else in Southern California. And half of the people in Ohio and Michigan the same. But then the other half, we asked about the other climate. So we asked the people in Southern California, how happy is a person who, just like you, with your values and interests, who lives in Michigan? Okay, and the same thing for Michigan and Southern California. Well, when you look at the results for people who actually live in those places, there's no difference in well-being, in life satisfaction. But when you ask them how well off, how satisfied people are who live in the other culture, in the other climate, it makes a big difference. Okay? And so the focusing illusion was the idea that the reason why they think there's a big difference is they focus on the differences between the two, and in particular, the differences that are easy to observe and seem meaningful. Okay. So if you talk to people in the Midwest, they think, about Southern California, they think about beaches and shopping on Rodeo Drive and the Hollywood Walk of Fame and all these wonderful things. And so those things get emphasized, and the weather and so forth. And similarly, going the other direction, from the weather is presumed to be worse, and some of those things are presumed to be less interesting when you're in the upper Midwest. And so this is the focusing illusion. Basically, anything that you focus on isn't as important as it is when you're focusing on it. So you exaggerate the importance of something because you're focusing on it. And this has turned out to be a very general phenomenon that has appeared in many different places. In fact, one of our later papers was about money, about income. And the title of that paper was, Would You Be Happier If You Were Richer? And sure enough, being richer does matter a little bit, but not nearly as much as people think it does. And so if you ask someone how happy someone who has an income under $20,000, let's say, we would be poor in America, how satisfied they are, and then you ask them, well, how satisfied is somebody who has a higher income, say over $100,000? People think there's a big difference. But when you ask the people who are actually in those lives, the difference is much smaller. There's a small difference, but it's much smaller. So this, again, is the focusing illusion. If you focus people on money, then they all of a sudden emphasize money in their evaluation. So that's one of the big paradoxes in well-being research that we have, I think, added something to. It's called the Easterland Paradox, after an economist called Richard Easterland, who was puzzling over the fact that over time, the average well-being of countries was pretty flat and didn't move around very much. And so, like, you have an economy like Japan, whose inflation-adjusted income has risen by 3 times since World War II, and they're flat on well-being. In China, the inflation-adjusted income on average has risen by like 5 or 7 times since the 1990s, and still very little change. The same is true in America and so forth. So there's this repeating pattern that somehow money isn't making people happier. What's going on here? Well, one of the things I think is going on is, as in the California study, when you transplant yourself from one environment to another, most of your life is the same. Your family is the same. You still go to grocery stores to buy stuff. You still watch programs on TV. You still go to work. You have a commute. All these things, although they're slightly different, are pretty much similar. And so there's a big common component to your life because of who you are, what kind of work you do, whether you're married, whether you have kids, all these sorts of things that are stable from environment to environment. Which means that the difference in actual well-being is going to be necessarily smaller than you might think if you focus on some difference. And the other element, of course, that it turns out to matter a lot is about half of well-being is an individual difference. That either is, we don't know for sure if it's genetic, it's a point of controversy, but it's experience, life experience, and genes, and whatever else that creates a stable level of well-being or happiness that the person sort of has as a main component of their well-being. So for all those reasons, changes in environment turn out to matter more than we think they should. We often will get the direction right in how it should change, but we greatly overestimate the magnitude. This is the focusing illusion. So the second aspect of our research, which I did with my colleagues Danny Kahneman, Norbert Schwartz, Arthur Stone, and Alan Kruger, was to develop a method for measuring well-being that was different than the ones that had been used before. And I mentioned earlier that the life satisfaction question that I said, taking everything into consideration, how satisfied are you with your life these days, was a question that involved a lot of judgment on the part of the person. There's an alternative way to think about it, and that is if you ask someone how they're doing at a particular moment, then that they might be able to answer that with less of these mental theories and frameworks influencing the result. And then if you could aggregate those up, then you would have a different measure of well-being that might have a different quality or different property than these global retrospective questions that are judgment-based. And so this actually has a philosophical roots that go back to Jeremy Bentham, who was talking about utilitarian measures of utility. And so the utilitarianism and utility go together, but there were different ways to look at this. And one goes back to Aristotle, and it's living a good life, virtue, service, duty, those kinds of things. But then on the other hand, there's this thing that has been referred to as hedonic, which has to do with the idea that something good is defined moment to moment, or experience to experience, rather than as a sort of large overarching type of concept. So this is a bottom-up way to measure satisfaction, or in this case, what we call affective experience. So we developed a measure that reflects this. That people had measured affective experience before using what's called experience sampling, where people are given a cell phone or a pager or something like that, and they're buzzed at random intervals and asked a short questionnaire about how they're feeling right then. Okay, whether they feel happy or sad or tense or tired, these sorts of responses. And again, the assumption is that their answer to that question at that very moment is almost an automatic response and not something that they do a lot of thinking about. Okay, this is the idea. But the problem with it is that type of method is very expensive, and you have to get a lot of observations from the same person. So it typically takes a week, sometimes longer, of data collection to get the data for one person. And so it might have costed $700 or $800 per person to get a participant. Well, this is completely impractical for a public policy tool, because if you want to incorporate affective experience into public policy, you need to get large samples that are representative of the population at some reasonable cost. And so what we were trying to do was to develop a technique that would accomplish that goal, that you would get essentially the same information that you would get if you had enough resources to do experience sampling for a large segment of the population, but in a way that was feasible. So we developed a survey-based method called the Day Reconstruction Method that involved remembering what happened yesterday, basically writing a diary of their previous day, putting it into a sequence of episodes like scenes in a movie of yesterday, and then we came back later and asked them about each scene, about each episode, how they felt. So we knew what they were doing, who they were with, where they were, and things of that type, what the name of the activity was that they were doing. Were they running? Were they playing? Were they relaxing? Were they exercising? Were they working, commuting, all these type of things. So we're able to get the sort of decomposition of the day into what they were doing, when they were doing it, for how long they were doing it, and how they felt while they were doing it. Okay, this was the raw data. And it turns out that people are able to do this reasonably reliably, not perfectly. And so in our science paper, we showed that this is a feasible and reliable, reasonably valid way to do this. And when you have large samples, the fact that an individual has some mistakes and some error in how they recreate their previous day averages out. Because for public policy, we're really not interested in individuals. We're interested in classes of individuals. We want to know how women in their 40s who are married, have small kids, and work feel about their day. Because public policy initiatives like cheaper, high-quality daycare would be something that would affect that class of people and not just a particular individual. And so then we have the beauty of large samples and the magic of the central limit theorem that helps us to get reliable measures for the group. And this is what we were able to do with the day reconstruction method. So it opened up an entirely new way of thinking about it, where you could look at time use as the basic design element of someone's life, how you spend your time. And so you could adjust how you spend your time so as to improve your affective experience. Okay, so I think this opened up a lot of new discussions. We weren't the only people working in this space, but that had a huge impact. And at the same time, we were working on the third thing, which is what we call national well-being accounts. So the idea was to have something parallel to the national income and product accounts, which are the economic criteria that are collected to compose GNP for the United States. And in other countries, there are similar types of collections of economic activity, which are then aggregated. So when you see some measure of GNP per capita or something like that, it's this economic data aggregated that you get. So it doesn't have things like well-being. And so what we wanted to do was to create a separate set of measurements of how people were doing, not just economically, but also in terms of their subjective well-being. And so that could also be used as a policy tool. And so that's why it became so important to create a method, which was the day reconstruction method, that was efficient enough to be able to use it for a population. So we were able to get the National Bureau of Labor Statistics in the United States, which I was already doing a time use survey, the National Time Use Survey, and get them to add a module. So they were already creating what we were calling the diary from the previous day, and they were doing it for the previous day also. But they weren't doing this affective evaluation component. So we proposed to them, and then we ran a trial, and they agreed to accept it. And so now the National Time Use Survey includes our module, where the respondents rate their affective experience for some of the episodes. And that's a nationally representative sample of between 13,000 and 20,000 that happens every year. So now you have data. So people who are interested in questions of non-economic measures of success have some data to work with in a nationally representative sample that's collected by the government. So that is a start. I have no doubt that there will be better measures created in the future of how to do this. But this is a start on having something to use and say, well, when does this line up with money and when doesn't it line up with money? What are we missing? You know, how come this and that? So a big example is commuting. In our studies and other studies, commuting is just about the worst experience or time use activity that people engage in. They hate it. And they hate it going to work, and they hate it coming back from work. They like it a little bit better coming back from work. But, and so it creates an entirely new way of thinking about this idea of urban revitalization and public transport and things of that type. If you can, people out here in California will drive an hour and a half or some ridiculous thing like that to get to work so they can live in a nice place, right? It's, from a well-being point of view, it's a poor trade-off, okay? And we're able to measure that in a very specific way because of the amount of time you're spending in particular activities. The second one that I've already alluded to is child care and taking care of your children. We got in a lot of trouble because when we first published our paper, we thought we were creating a method, but all the reporters wanted to ask us, oh, so people really like sex. That's amazing. Really? And then also, but women don't like taking care of their children. You know, are they bad mothers? And so we're getting all these questions that we had no intention of answering, right? This was just the data. But we discovered an interesting distinction, and that is that taking care of your children is a lot of work. Most of the time, it's work. Get in the bath, clean up your room, do your homework, get ready, it's time to go to school, all these types of things, and it's a little bit like work. And work's not a really great activity. You have to pay people to work. People don't do it for free, you know. And so, although there are these moments of joy and happiness and satisfaction with kids, a lot of it, especially when they're small, involves mainly work and routine activity. And so later in our studies, we separated out two different activities. One is playing with your children, and that was way at the top. A very good example of a dissociation between what people say about an activity and how they actually feel while they're doing it is child care, or taking care of your children was the activity as we described it. Taking care of your children turned out to rank pretty low among other activities, which really surprised people. They say, but children are the most important thing in my life, you know, and this is really important. So if you ask people a global retrospective question, what are the most important activities in your life? How important is it to you? They rank children very high. Okay, so there was this conflict between a low ranking by moment-to-moment experience and a high ranking by people evaluating their lives. Well, it's explicable then, right? Because when they're selecting moments to evaluate how important it is or how much they like having children, they selectively think about the good things. The joy, the happiness, the interaction, the shared success in their achievements and so forth. And they're not talking about getting in the bathtub, cleaning up their room, or getting ready to go to school. Do you see? So it's a natural distinction. And so one of the things that you might say, again, is to the extent that the sort of routine mechanical activities of raising children can be assisted in some way, there's a public policy option there, okay, that could really improve well-being, possibly at not a particularly high cost. In France, high-quality, free daycare that is typically very close to where you live is available. Well, this seems like a great hedonic benefit, okay, because you're reducing the work part of the child raising and allowing more of the time to be on the really joyous, happy, satisfying part. So there's an example of how a policy could match up with a disparity that was identified by looking at activity-based measures of well-being. And in every developing society, there are going to be dissociations like that. People think that this is really a good thing, but then you actually measure it and say, well, it's actually not so great. You know, or they think, well, you know, that thing must not be very good. People say, oh, no, it's actually pretty good. And so you're wasting money and you're being inefficient in the policies because you're sending them to what your theory of life tells you is a good thing and not to what the actual experience of life turns out to be. What social change would I like to see? I think one of the most significant social changes that's happened in the last 200 years, and it's only happened in the last 200 years in Western societies primarily, is general education for the population. I think it's hard to overestimate how significant a difference that has made in societies in terms of the human capital available to expand economic and social activity. And I think in developing economies, this is the same problem right now. It often comes in the form of whether women can get education, girls can get education or not. But there's also true for the boys as well. If you look in places like Africa, Afghanistan, or Western China, the rural areas, education is still not all that well, it's not that equal between what the people who live in Shanghai or Beijing, the central cities, get. And so I think this would be something that would be on my mind if I was going to punch one button, is to figure out how to, at a reasonable price, equate or reduce the disparity in inequality between how education is delivered to people in different places in a particular country. And I think the internet has given us some new tools. We haven't figured out how to use them yet, but I think it's something that gives us a lot of hope that this type of thing could really be improved tremendously in a relatively short period of time. I mean, a decade or two. And so I think this is something that could make an enormous difference in the world. You think about the untapped resources of people who are still mostly, poor and uneducated. If you look at the world population, think of all the new things we could come up with, the new discoveries that could be made, the intellectual resources that would be available to societies, to companies, to governments. I think that's a hugely untapped resource. And as I said, in particular, giving access to girls and women in countries that currently discourage this.